Today we are going to see about liver function test. The routine markers of liver disease commonly known as liver function test. It includes 5 groups. Okay, the first group includes the bilirubin present in the serum, that is the total and conjugated, and the urine consists of bile pigments, bile salts and urobilinogen. The group 2 includes hepatic enzyme panel, which contains ALT, AST, ALP, GGT. The ALT and AST are used to distinguish between the pattern of the liver disease. Then the group 3 includes serum proteins, that is the albumin and globulin, AG ratio, which determines the chronicity. Then prothrombin time, it determines the severity of the liver function. Blood ammonia, it helps in finding the hepatic failure and urea cycle disorders. Then in group 4, there are some special tests for finding the metabolic liver disease that includes alpha fetoprotein. If the alpha fetoprotein is increased, that means it's an indication of primary hepatocellular carcinoma. The second one is alpha 1 antitrypsin. If the alpha 1 antitrypsin is low, it indicates micronodular cirrhosis. The others are beta 2 microglobulins, ceruloplasmin, ferritin and iron. Group 5 includes direct and indirect markers of hepatic fibrosis, which includes serum hyaluronic acid SHA. MMP means matrix metalloproteinases. TIMP means tissue inhibitors of MMP. Then TGF beta 1, that means transforming growth factor beta 1. Before knowing about the markers of livers, first we know the basics. So first we will see that. So here, when the RBCs are break down, heme is released and it is converted into biliverdin by heme oxygenase. Biliverdin is converted into unconjugated bilirubin by biliverdin reductase. So this one binds with albumin and enters the liver, and it gets converted into conjugated bilirubin by UDP glucuronide transferase, which then finally enters the biliary system. This is important because if there is any defective conjugation, then it leads to increased production of unconjugated bilirubin, which is the hemolytic jaundice. Same way, if there is increased in conjugated bilirubin, that means it indicates obstructive or post-hepatic jaundice. The normal level of total bilirubin is 1 mg per deciliter. So next I have given in tabular column the difference between the serum markers and urine markers between hemolytic jaundice, obstructive jaundice and hepatocellular jaundice. Take a look at that. Next we will see about van den Berg reaction. So it consists of a reagent called van den Berg reagent, which is a combination of sulfonilic acid and sodium nitrate. The sulfonilic acid binds with the bilirubin and forms azobilirubin, which is purple in color. If the purple color is formed immediately, it means direct positive reaction. If it forms only after adding alcohol, it is indirect positive reaction. If it is both immediate and on addition of alcohol, it is called as biphasic reaction. You have to remember 3 tests. First one is Foucher's test, which helps to detect the bilirubin. Then Ehrlich's test to detect the urobilinogen, and Hayes test to detect the bile salt. The levels of ALT and AST are always elevated in all liver diseases. If there is an abnormal liver profile enzyme, divide that into 2 types, ALT or AST more than 3 times the normal value and ALP less than 2 times the normal value. It indicates hepatocellular disease. In the same way, if the ALT or AST is less than the 3 times of the normal value, it indicates cholestatic disease.